Hey guys, welcome back to Red River TV. Today we are sitting down with Liza Greve. Liza Greve is the director of OKHPR, also known as Oklahoma for Health and Parental Rights. Now, I know some of our followers have personally told us that they follow Liza and they follow the group, they follow everything that you guys have been doing in Oklahoma. So we're going to sit down with her today and we're going to ask her a few questions about their organization. First question, Liza, and welcome to the show.
Thank you.
First question we have is this group has carried much influence in Oklahoma, not just amongst the constituency, but Oklahoma's government as well, as far as working with lawmakers and legislation. Tell us a little bit about what you do and how this organization has really helped Oklahomans understand medical freedom.
Well, our main areas that we work in is medical privacy, parental rights, informed consent, and obviously health freedom.
Yes.
We're broadening and going more into the school choice area.
Wow.
But yeah, it started about 7 years ago when a senator was trying to take away the vaccine exemptions.
Yes.
And, we've had those vaccine exemptions, personal, religious, and medical, for 50 years.
Yes.
And when that took place, there was a need for some activism, some parental authority to come in and say, hey, let's just leave things alone. And that's when our group started. And, it wasn't necessarily a popular issue. We did have still a lot of support.
Yeah.
But as you can see with the pandemic over the last year, our issue has been, from the bottom 10 to, if even that, maybe 20, 30,
Yes.
to, top 5 issues in the United States.
Yes.
People are really starting to wake up to some of the things that we've been talking about for, like I said, almost 7 years.
Wow. Wow. We've noticed too that people have really responded differently to the subject even of vaccines, which I find interesting. I mean, I've talked to people personally that have said, they've had the whole, anti-vaxxer, pro-vaxxer kind of a, back and forth war, but now they're starting to understand what that looks like because they're being personally affected by it as an adult, or their children is being affected by it as a child. It's been really interesting to watch that change. Okay, second question. Has the conversation changed? And you hit on some of this already, but has the conversation changed surrounding, like you said, medical privacy, medical freedom concerning COVID-19? Do you believe that Americans are finally waking up to that?
I do believe that Americans are waking up. I think the whole COVID-19 brought so many areas to light. I think it started with, do you remember the data collection with the COVID deaths?
Yeah.
And they were saying, well, if you tested positive for COVID, you're going to be marked in this category. And this was the CDC. And so that, I believe that was the first kind of enlightenment that people began to see. It's like, wait a minute, they died of a heart attack, but they're being categorized.
Exactly.
So that was kind of the start. And then there's been a number of things back and forth that have happened. One day masks are not effective, then the next day they are. And, we've been saying for a long time that the issue with, being, quote, anti-vax, or this term that they've labeled as vaccine hesitancy, there's a reason for it. And the reason is that people distrust the information,
Absolutely.
the guidance that's coming from public health officials.
Yes.
Therefore, instead of maybe attacking the individuals that have questions, let's look at the public health guidance and look at the transparency there. Let's look at, the concerns of the constituents and address it from that angle instead of just attacking people and their message. And I think that's what people have begun to see, that we've got problems with our messaging and the information that's coming. And until we deal with that trust issue, you're not going to have people be compliant with what you say.
Absolutely. And I want our followers to pay attention to the last statement that she made, because a lot of people are still not facing that reality. They are not facing the reality that you don't see it as freedom. You don't see what is happening to your body. as freedom. And you don't see what the government has been trying to implement literally by force in some cases. They're not seeing it as a freedom being taken away from you. And that's what I love about what you guys do, is that you guys bring attention to that and say, you have an individual right to protect yourself and to protect your children. And like you said, here we are. Here we are. It's come crashing through our front door, whether we want to deal with it or not. So, question. Let's say that I'm a person, I've had my job maybe, 5 years, maybe 10 years, some people 15 years. And it's starting to circle around my job that there may be possibly, a vaccine mandate where it's like you're going to have to get vaccinated or else you're going to lose, your place of employment. What do you say to those people? How can we help those people know, like, what do I do? How do I navigate through that?
Mm-hmm. So, number one, this vaccine is not FDA approved yet. So, legally, there should be no mandates coming. Now, will they try it? Possibly, because they know they're probably not going to get sued and pushed back. So, we've got to push back on it. But when it is FDA approved, of course, it could come. But I'm encouraging Oklahomans and anybody watching, really, start reaching out to your legislature. We have got to start respecting employee rights. We know there's workplace policy. It's important to have that control. But when it comes to vaccines and your body, there's got to be a line drawn. And I think this is it. So we really encourage you to push your legislature. We had a bill in the Oklahoma Senate this year, and it didn't get out of committee because the Senate didn't want to overstep the rights of the employer.
Exactly.
And it's time for some changes. I mean, we respect those rights so much, but there's got to be a line, and I think this is it.
Absolutely. And I think that you guys will be able to find info as well on their website. You guys have so many new things that's coming up now.
Yeah. So in about, I would say 3 to 4 days, we're going to add a letter that we had drafted with our attorneys that you guys can go to get at least something in writing to give to your employer that will be helpful. It's not legal advice, but it'll be definitely a start.
Absolutely. Okay, and Senate Bill 658. Tell us a little bit about that.
Okay, 658 is a bill that was signed into law. It's effective July 1st. And it's basically making sure that no school in Oklahoma and no university will do 3 things. First of all, you will not discriminate against a student for not having the vaccine. So you can't have like masking sections and not masking sections. You can't mandate the COVID vaccine, and you must also give parents information about exemptions. Now, if you have a school or a university that's not following the law, we have a section on our website where you can report it, and we will investigate and we will handle it if the law has any authority on this issue.
Wow.
Yeah. It is law now.
It is. It is. You guys go and check that out, especially because, we're in the summertime. Mm-hmm. And it would be good to be informed going into the next school year.
And there's some universities that said they would have mandated the COVID vaccine, Oklahoma University. Wow. But for this law, now
that's awesome.
Cannot. So,
that's awesome.
Yeah.
How can people support OKHPR? How can they support you guys?
Well, they can just go to our website. It's OKHPR.com. And we have quite a few things on there, not just financial support, but we actually have a new health professionals organization that we've started under ours. And so if you are a health professional in any capacity, even social workers, anybody that has patient contact, please go to our website and join, because what we're doing is we're trying to get some networking going in these areas of health professionals, because the health professionals are getting mandates like no other field, obviously. Yeah. And so they're going to need to network, because there's a lot of health professionals regarding the COVID vaccine that have a lot of questions and concerns. And some of them are willing to quit their jobs. Wow. For this. And so they're going to need to reach out to others and find other ways to provide for their family. And so we set this up in an effort to bring us together, because we can't do very much alone, but we can do a lot when we fight together.
Absolutely. Thank you so much for coming in, Liza. We so appreciate it.
Thank you.
You guys, until next time, I am Janelle Batts with Red River TV.